Good morning, everybody. It's Friday morning. Sorry I'm a little bit late on this live. I had to take Buddy into the beauty salon to get his golden doodle hair fixed. Um, as you see, I've got let me see, what's your point? Chi University shirt on today. Hi, Dee. I saw Dee up at Chi University when I was up there teaching a couple weeks ago, which was awesome. And I've had a couple of synchronicities happen over the past week or so, and I kind of follow what's showing up on my. Let me turn these notifications off. I kind of follow what's showing up on my screen in terms of themes for these, but I saw a new client a couple days ago. I didn't She called me up, wanted me to come and see her 17-year-old dog. And she asked me if I could help with SARS, which is sudden um, retinal degeneration. And there was a problem list of about 4 different things that was going on with the dog. So I showed up at her house. The dog was laying in what we call lateral recumbency on his side, wasn't really even responsive when I came into the room. I asked him some questions. The dog was breathing, but wasn't really looking up at me. I petted the dog and talked to her and proceeded to get a long history, and she had a whole coffee table full of supplements and food that she was giving. Um, she was making her own homemade food, and the dog was 17 years old, but had some issues. Had vestibular disease, had gone blind about 5 years ago, but was managing that okay, and now couldn't get up on its own. And I got the dog up and started palpating the dog and moving the joints around, and realized the dog had some severe stiffness and arthritis in its hind legs, the lumbosacral region, probably lower lumbar vertebrae and hips. So I'm I'm not jumping on the whole Pleckner bandwagon, D, sitting back and seeing. So anyways, I've actually had a couple early SARS cases that, we stopped the progression of the disease. So anyways, SARS wasn't this dog's biggest problem. It was laying on the floor and couldn't get up and had vestibular disease along with whatever was going on the high end. So I started putting needles in, and the dog just completely relaxed. She complained the dog would get very anxiety ridden and sit and paw at the floor trying to get itself righted up into an upright position, or trying to get on its all 4 legs, and it couldn't do so by itself. Now these are these people's very first dog. They don't understand dogs like a lot of us do that are probably on this call. So when I put the acupuncture needles in and the dog totally relaxed, literally almost started snoring, and you could just see its body just finally just like, that wonderful feeling that those of us who do get acupuncture can see. And the my client was like, wow, the dog had been going to a couple different clinics in my area to get acupuncture, and she said, "Wow, she's never responded to acupuncture like this before." And I'm like, "Really? Like, where did you go get acupuncture and how was it done?" So we started having a discussion, and the dog had gone in for ozone therapy and this, that, and the other, and I said, "Well, who was doing the acupuncture?" And she said, "Well, the first time it was a veterinarian, but then the other times the techs just came in and did it." And I was like, "Really? The veterinary technicians were inserting the needles and doing acupuncture on your dog?" And she said, "Yes." And I'm like, "Wow, that's really interesting." Um, for a couple different reasons. Number one, in the practice acts of most states, and according to the American Veterinary Medical Association, which I mean, we all have our disagreements with these, but we do have professional organizations to oversee certain things, and this is one of those times when I think it's a good thing. They classify acupuncture as a surgical procedure because you are inserting metal needles through the skin into the tissues of an animal. So it is an interventive procedure. Now, in order to do acupuncture, you need to be a licensed veterinarian. So there's a whole big issue with this going on in the human acupuncture field where they have coined the term dry needling, which dry needling to me, it's acupuncture. It's putting acupuncture needles into the skin. You aren't injecting anything into the points. You aren't attaching electroacupuncture or anything like that. It's just the plain needles. Well, the physical rehab people and some chiropractors of things have gotten around the acupuncture rules and regs in the human field by calling it dry needling instead of acupuncture. They are still inserting needles into the skin. When you break that skin barrier, a couple different things can happen. Infection can happen. You need to understand the anatomy underlying this area where your needle is going into. Like you don't, I teach acupuncture to other veterinarians. You don't want an acupuncture needle going straight into a tendon. It really hurts. And it's not what you do. You want to be careful of major blood vessels. You want to, and there's a certain way of inserting them and a certain way of finding these very pretty small points, very, very specific points on the body that were mapped out thousands and thousands and thousands of years ago to get specific effects. And when you put an acupuncture into an acupuncture point, lots of different things take place. And there's lots of research showing these different things taking place. So you're not just going into a trigger point. Like a lot of physical rehab people are taking needles into trigger points and just pounding them, like doing plum flower technique, but deep in the muscles. And that's trauma. I mean, there may be times when an acupuncturist might do that, but to not know what you're doing and to not know what's underlying there and to not know the whole entire theory of medicine behind this is a big, big issue. Okay. Yeah. There's the pulse and tongue, of course, but that goes along with developing your Chinese medical pattern diagnosis is taking pulses, taking tongues, but I'm also doing a whole lot of other things. I'm watching that dog's behavior in that environment, the patient's behavior. I'm looking at their shen, I'm looking at their eyes, I'm looking at how they're holding their body. I'm feeling association points, I'm feeling moo alarm points. I am feeling and palpating every single acupuncture point I'm going to use for heat, for coldness, for stagnation, for flow, for excess, for deficiency, for all of these different things. There's a lot going on. Plus, I'm looking at it from a Western medical perspective at the same time. So when I take an acupuncture needle and you put it in the body into an acupuncture point, that acupuncture needle is stimulating and sending signals to the sympathetic nervous system, the parasympathetic nervous system. It is releasing neurotransmitters, endorphins, local inflammatory mediators on a local thing, cytokines. It is affecting the immune system, the endocrine system, the whole entire body. Now, there are systems of acupuncture using just one needle to treat pain, to treat cancers and other things. So they can be very, very, very powerful. One little tiny acupuncture point needle going into one point is a very, very powerful treatment. And we forget that. We have this beautiful system of medicine which acupuncture is only one of, say, 8 branches. Some people even include other branches in there as well. So there's massage therapy, there's food therapy, there's herbal medicine, there's acupuncture, there's the ancient Chinese also included qigong and even um, astrology. the cosmos, the position of the planets. All of this is included within their huge system of medicine that they have been using far longer than Western medicine and our antibiotics. I'll tell you that much. So we're tapping into a lot of knowledge there. Um, and to just have a technician, if you're going to a clinic and a technician is placing the acupuncture needles in your dog, I wouldn't. I would find a new clinic. I mean, I just don't think that's kosher. Number 1, it's probably breaking some of the practice laws, and number 2, it could potentially put your dog in danger, and number 3, your dog's probably not gonna get as good of acupuncture treatment. Just like going back to my client said, her dog didn't even relax during the acupuncture treatments, and they didn't see much relief. So, when I took the needles out of this dog, I told her, I said, I want you to do this, this, and this over the weekend. I want to see the dog next week. I need to see the dog at least once a week for 4 times to see if we can get her back up on her feet and see if we can help her. And if it's not helping, we're going to have to be making different decisions about her quality of life. So I packed up my bags. She was walking me out to the door, and her son was following us with the dog, and I didn't realize it. I got to my car and turned around. The dog was up on her feet, literally walking, sniffing around in the grass, and walking on her own, um, which she hadn't been doing. They'd had to lift her up, carry her, set her down, and then she'd collapse. So just that one treatment gave them some hope, gave me some hope, and really helped the dog's pain level and functional level. Okay. Um, Now, another point in terms of this westernization of acupuncture came to me when I was up at Shi University teaching. And we teach live labs with live dogs. So I have 5 veterinarians that are taking the course, and they get a certain amount of lab time to actually be able to palpate, find the anatomical landmarks, and feel these acupuncture points so that they can point them out on a test. And I teach them how to insert the needles. I teach them to watch for what we call the Da Qi response, which means the arrival of qi at that point. So, what we're doing when we're doing acupuncture is we're altering the energy flow in the body. If it's blocked, the Chinese say there's all these channels that they have mapped out with qi, which is life force energy flowing through the channels. Now, ideally, to be in optimal health, that qi flows through all the channels evenly through a rhythm throughout the day, according to the hours of the day. It also flows in a rhythm through the seasons, according to the seasons of the year. If the flow gets blocked and stopped up somewhere, it's like putting a dam in a river and that energy backs up and you get stagnant energy in some of the points, which can eventually lead to pain issues. So when you put an acupuncture needle in, you can open up that flow. You can add energy, chi into the meridian and bolster it for deficiencies. You can do a lot of different things. But what is really important is both the chi of the practitioner, where my energy is for that day, and the intention that I bring when I am doing acupuncture. Now, if you're just going in there, "Oh, a rehab person, I'm just gonna jab at this trigger point, boo, 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 boom, and, open it up," it's kinda not the same thing. So you have to understand anatomy, you have to understand physiology, you also have to understand the specific species you're working on. So when and this is an issue some human acupuncturists brought up is, well, we know all this theory and we know acupuncture so much better than a lot of vets that are just getting what's called medical acupuncture, which I'll describe. So why can't we do acupuncture on animals? Because animals are not humans. We have the human animal we have the dog animal, we have the cat animal, we have the horse animal, and we have a whole lot of other animals. When we go to veterinary school, we learn everything they learn in human medical school: anatomy, physiology, pathophysiology, immunology, virology, da, 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 da. I can list them all out. There's a lot. But we also learn the basic mammalian body plan, which includes the human animal. And then we learn all the differences for, I'll answer that, Dee. We learn all the differences between the species. So, like, cats have clavicles, have collarbones like humans do. Dogs don't have collarbones. Horses walk around, the horse's hoof is our fingernail. So they walk around on feet that are actually our fingers. So there's major anatomical differences. And there's also differences in, like ruminants, cows have four-chambered stomachs. Dogs and cats are carnivores, so they have a different digestive system. Um, so there's differences you need to know, and there's different disease processes that each species develops and has a tendency to. Like cats have a tendency towards getting overactive thyroid glands. Dogs have a tendency for getting underactive thyroid glands. So there's a lot going on here that a human acupuncturist does not have the knowledge available to them. I have actually treated many, many, many human acupuncturist dogs because, number one, they didn't want to treat their own dog because they were intelligent enough to know and wise enough that it's very difficult to treat your own animal. Secondly, because of the emotional attachment. Secondly, they knew they did not know enough about a quadruped versus a biped, and human animal versus a dog animal to not, mess things up. Now, I've even gone over, I have a good friend who's a five-element acupuncturist, and I've gone over and I've taught her where to find the points on her dog and showed her it's not even like a matter of putting a piece of tape or a star or a Sharpie. You have to feel for the anatomical landmarks. So you're feeling muscles, you're feeling bony protuberances, you're feeling joints, you're feeling tendons and ligaments. You're palpating the body to find these points. So if you don't know your anatomy, it's going to be really, really, really hard to figure out where the points are. Oh, this little bump here. No, it's not this little bump here. It's the medial epicondyle of the humerus, and you're going to go cranial to the medial epicondyle of the humerus. The other thing that's different is the proportional measurements we use in acupuncture, which are called Chuen, C-U-N. In humans, that's 3 finger widths. But that's because most humans are the fingers of the human work on their particular body. What is 3 finger widths on a cat? What is 3 finger widths on a dog? So you have to understand what those proportional measurements are so that you can find them on all these different species of animals, which is something that is not taught in human acupuncture school. Okay, so these are just a few of the issues. But my big issue that came up, I'm just going to answer Dee's question. Western and Eastern animal medicine, published crosswalks. I'm not sure what you're talking about. I mean, my brain is a I always tell people one half of my brain is working in terms of Western medicine and one half of my brain is working in terms of Eastern medicine. And another half of my brain is I just leave wide open for whatever needs to come down and through. There isn't really. I mean, it's a huge, huge, huge topic. I've been studying this and practicing this for 25 years, and I still feel like I know this much. It's kind of like the more you know, the more you realize you don't know. Um, because things happen with my patients and treatments I have no explanation for. Good things, and sometimes they just tank and go downhill, and no matter what I do. So, life is a mystery. And that's the other part. I think we need to get to this point. We don't know everything. And God forbid, AI doesn't know everything. AI is an outgrowth of this. And we do not know everything. There is so much, especially when we're dealing with the living universe and living organisms, that we don't know. And if we could, as humans, just acknowledge that and take our egos down a few notches. I mean, the stuff we're finding out biochemically with all of these different nutrients that we're missing and what those do, even for our brain health alone. We know the tip of the iceberg. So, anyways, the thing that really bothered me about She is I had a student there, and she was saying I was teaching them a point called GV20. On humans, it's called byway, and on animals, it's called byway as well. It's right on the top of the head, and on humans and animals, it's where the sutures of the skull bones come together. It's that baby's soft spot when they're little infants that takes some time to close up. In Chihuahuas, and now here's a certain breed difference, sometimes it never closes up. So some Chihuahuas have a little open fontanelle, a hole there between their bones, that if you put a needle down in there, you could go straight into the brain if you went far enough. Okay. So this is called Byway, which means the meeting of 1,000 points. It is also in Buddhism and Hinduism. It's like they'll call it the thousand-petaled lotus. It is the center of the crown chakra in the chakra system of Hinduism. In Tibetan Buddhism, it is the center of the thousand-petaled lotus, and it is in Taoism and Buddhism both. It is where cosmic divine energy can flow down into our brain through the center of our skull, down our central channel. Now, for me, that's a very sacred point because I practice meditation. I've studied Taoism and I've studied Buddhism and practiced Tibetan Buddhism for about 25 years. I began my study of Taoism before I even went into acupuncture school. Actually, a Taoist master showed up in Miami, put in this small little ad in a local back in the day. This was like in 2000. There were these little local neighborhood newspapers. And I was actually sitting in the emergency room of a hospital waiting on a friend who had to go to the emergency room for a really bad urinary tract infection. And I was hanging out waiting for her. And I picked up this little newspaper article and I saw the ad and it said something about inner alchemy and finding inner peace. And I was at a point in my life, I graduated from veterinary school. I was at my third job as a veterinarian, working in a clinic actually in South Beach in Miami. And I needed my own healing. I was literally looking for a path for myself. And I had not yet signed up for the acupuncture course with Dr. Shea. And so I called this woman up. Well, it turned out she was a Taoist. She was a very well trained Taoist from Taiwan, and she had spent a lot of time in Chinese Taoist temples, training in inner alchemy. And she trained me and a small group of women in Miami in inner alchemy and in the cultivation of our chi and exercises, energy exercises and meditation exercises on how to learn to fill up our dantian with chi, which is it's in the pelvis, in the lower belly, and it's a sea of chi. And you can actually do breathing exercises, drawing in divine cosmic energy and filling that up, and then learning how to circulate it. And I knew I was going all the way from veterinary school. I knew I was going to be practicing acupuncture on animals. And years and years ago, before I even got to veterinary school, I picked up Ted Kapchuk's book called The Web That Has No Weaver. It was one of the first books, I think, written in English on traditional Chinese medicine. And what grabbed me was the title of the book. I was a college student living in Boulder, Colorado at the time, studying biology. And I'm like, "The web that has no weaver, I need to read this." Well, I devoured that book cover to cover, and it implanted in me many of the classic ideas behind TCM that have been gotten pushed to the side. So, traditional Chinese medicine was developed by the ancient Taoists who lived out in the mountains and were very in touch with nature and were concerned with longevity and were incredible observers and witnesses of how the body interacted with nature and the fact that, and this is a spiritual maxim coming all the way from the East to Hermetic philosophy in Europe and back into ancient Egypt, that says that the microcosm is a reflection of the microcosm is a reflection of the macrocosm. As above, so below. As without, so within. Now, many people attribute that to ancient Taoists. They also attribute it to Hermes Trismegistus and the emerald tablets of ancient Egypt. It's used, like I say, in Western Hermetic magical schools and Eastern. And so there's something to that. So the ancient Chinese looked at the body as a temple and as a reflection of the divine without. And so you treat the body with reverence as a sacred object. So this back to Chi University, and I'm sitting there with a student, and she's like, "Oh, I teach them Bai Wei, which is the center of the thousand-petaled lotus that is the where our skull sutras come together, where that divine energy can come down and into our central channel. It's something that we utilize during those inner alchemy teachings." And she said, "Oh, we take anesthetic sedative drugs and inject into that point, and they work great. We only have to use a very small amount of drug to inject into that point." And it literally just like, it was like getting sucker punched to me. I got thrown back at the wall. And I'm like, "You do what?" "Oh, we inject anesthetic drugs." Now, number one, that's a really sacred, reverent point in the body. Number two, in dogs, it's right on the ridge bone, and there's very little skin and very little, like, you can't pick up the skin and put a needle in. So there's very little space there. Now, we do injectable acupuncture, usually using vitamin B12. Sometimes I will put adequate in acupuncture points. Sometimes I will put a homeopathic medication called Tramiel into acupuncture points. But I don't use pharmaceutical drugs and put into acupuncture points, especially a point with as much reverence that I have for it as Bai Wei on the top of the head. And this is just one example, kind of like the needling the trigger points and dry needling of physical rehab, of where we're trying to westernize and scientize traditional Chinese medicine. And it's almost another example of America taking something and saying, well, we're going to make it bigger and better and stronger and make it American. I'm proud to be an American. I am. I still think with everything going on in the world, this is the best place to be in the world right now. We have a constitution written by very brilliant men to keep freedom of speech and things alive here. But we need to have some amount of respect for the ancient traditions and for this medicine. And I would never think about injecting the drug into that point. I just wouldn't. Um, and it's something I think we need to have a conversation with. And about. And I know I put up the topic of this talk, and a bunch of human acupuncturists jumped on because we are seeing acupuncture become like It'd be like going in and getting a Swedish massage of somebody not really knowing what they're doing, inserting needles, maybe not even into acupuncture points. They're just kind of throwing them in wherever they think they should throw them in. And that is not acupuncture. That is not medicine. So we need to be very aware of that. I think the doctors practicing it, doctors not practicing it, practicing it, vets not practicing it. And consumers, if you're gonna take your animal to an acupuncturist, or if you yourself are gonna go to an acupuncturist, you need to know these things. Now, I will say in veterinary medicine, there are two main schools of acupuncture. The International Veterinary Acupuncture Society, which has been around a very, very long time, has very good teachers, teaches a lot of good philosophy. It teaches the physiology. It teaches the medicine. Chi University, who's started by Dr. Shea, it's the same thing and gives people a good foundation. You have to be a veterinarian in order to take their acupuncture course in both of these with both of these schools. Now there's another school that was started up called medical acupuncture, which is completely westernizing acupuncture. And actually, I believe on their website, it's pretty front and center. We don't talk about nebulous things like chi at our acupuncture school. Now, even though in all of our wondrous intelligence of modern man, we can't figure out what chi is. We have measured it. I felt it flowing through meridians. It is there. But just because they can't put a Western scientific, let's grab it and hold on to it type of thing on chi, they're going to take chi out of practicing medicine, acupuncture. That's what we're working with when we practice acupuncture. That's what's flowing through those channels when we're practicing acupuncture. So to take it out is just absolutely ridiculous to me. And I try to steer veterinarians into one of the other schools because I don't think you're even really practicing I don't know what you're practicing when you come out of that school. They'd say there's a neurophysiological base. Yes, there is, but there's a whole nother world there that we are also working with. We call it energy, which is kind of nebulous and not well defined, but it's certainly there. And again, we are not the highest pinnacle of intelligence where we're sitting, although we like to think ourselves are. But look at the state of the world. We're killing each other. Between genetic engineering, which is opening up a whole can of worms that is as serious as splitting the atom, in my mind, we're changing the genetic blueprint of humanity. And we've got biological warfare going on that is signed off for, but not just by the government in the United States, but around the world. We've still got genocide happening. We've still got all these things going on. We're not in a really good place, and I don't think we should pat ourselves on the back for being the smartest, most intelligent thing on the planet that the planet's ever seen. That's just my take on all of that. But we do need to have a reverence for this medicine. Every time I put an acupuncture needle into a dog or cat, I have the intention behind it of do no harm and hopefully make their quality of life better and to help them on their journey forward, whether that is to continue to live another day or whether that is to release themselves from the physical and it's time to go on to a different life. So that's where I stand. I'm just going to look through some of the comments here. I know this is a huge topic. I am actually going to be talking at the American Holistic Veterinary Medical Association this year, bringing up the classics of TCM and going back to the 5-element system and how our bodies are a reflection of our environments before placing needles. I mean, and some of us, we know the animals, so sometimes I won't take pulses myself, Dee, but I know I know the animal, and I usually feel the pulses on everybody, but it's not the absolute be all end all. Some people rely on pulses more than others. I rely on looking at a whole bunch of different things when I'm doing it. Um, it is normal for acupuncture needles to fall out in fire element dogs. Sometimes you put the needles in, they stand up, they shake, and needles go flying out all over the place. What's most important for an acupuncture needle is for it to go in and for you to get some kind of Dachi response. So maybe the dog might just look back at you. Maybe their muscles will flinch. Maybe they'll go, ah! Maybe there'll be I felt it on myself as a bolt of electricity running down the meridian. I'll feel the meridian open up and the flow open up. For a dog, they might start licking at the end of the meridian or another point along the meridian. So I'm watching them on what they are telling me and showing me about their bodies, because they can't talk to us, but they talk to us in other ways. Sometimes I've had to put a needle in and there's so much chi at the point where I put the needle, it blows the needle right back out at me. That happened. Somebody put a needle in my ear once and it popped right out and flew across the room. So yeah, needles can come out. Um, there are no real published crosswalks. They attribute it to Satan too, as above, so below. I mean, that's Christian. Christians came up with Satan. No, I believe there's evil in the world. Believe me, I believe there's demonic, like chaotic forces. But as above, so below is not a satanic. Please, if you're gonna go down that route, just go down that route. Fine, over there. Um, let me see. Agree, we should not overlay our system onto theirs. I mean, the systems can interconnect. But to be injecting and to be taking the chi out of acupuncture and things like this, no. I had an acupuncture treatment from a human acupuncturist without taking an oriental pulse. I mean, again, there's different things. My acupuncturist, I would walk into his office. He did medical qigong for 30 years in a Chinese hospital. I watched him take his finger and knit a ligament in a knee on my roommate back together again. He went in he heard the ligament pop. His knee swelled up to twice the size. He couldn't put weight on it. He went in to see Dr. Liao for 5 treatments and it was good to go. And he hasn't, like 15 years later, he still doesn't complain about his knee. We're just not advanced enough to understand it. Exactly. There's things in this world that we don't understand, and we have been so separated from the spiritual world. And that happened, honestly. A lot of people say going back to the 3 Abrahamic religions, Judaism, Christianity, and Muslim and Islam, where, oh, we can't connect to spirit ourselves. We have to go through a priest and ask the priest, and they're the only ones that have access to God. Listen, we all have God all around us. These plants behind me, the tree behind me, the sunlight streaming through them, that is all chi. The Taoists actually don't even believe in a God. They believe in the Tao. Buddhists as well. They may have deities and Buddhas, but those Buddhists were humans that then really achieved enlightenment. So they don't believe in a one single God. So they're not monotheistic. On energy, what's the latest understanding of the heart torus? I haven't. Heart math is a good place to go to understand that. I just learned of a teaching about the heart recently with Dr. with Jeffrey Ewan, who's the 13th, I think he's even more, 87th lineage holder of Taoism. He was saying that in ancient acupuncture, there was no heart meridian. And they thought of the pericardium as muscles that were surrounding the energetic heart center that held the Shen. And then I just saw something, they're talking about the heart torus field, but they're talking about not the heart being a pump, but they drew out the muscles of the heart forming the ventricle that was like a muscle layer that wrapped around, forming this toroidal, kind of gathering the toroidal field to direct the energy of the toroidal field along the flow of blood coming into the heart, going to the lungs, coming from the lungs, and going out oxygenated to the body. It was very, very interesting. So there's a lot that we don't even know about the heart, but it is not a pump that, like a water pump that pumps blood. It's definitely not. It actually forms these currents in the blood, which the blood flows spirally through the vessels. So that's really interesting as a deep dive into that. The Beating Heart is a book I'm reading now. So I don't know if they talk about that or not, Dee, but yeah, he said that there was no heart channel. They made up the heart channel later on in acupuncture. So what I would say for all of the human licensed acupuncturists, for the veterinary licensed acupuncturists, we need to be guardians of this incredible knowledge and this system of medicine that has been given to us. And we need to protect it. We need to practice it with reverence. It allows my energy field to interact with another animal's energy field. And I have seen it do really amazing things. I have seen it save lives. I've seen it give dogs, bring life back to a dog so that they can continue on their journey with their human. Um, and some amazing healing can happen from it. A lot of my patients that I'm seeing doing regular acupuncture on, actually over many, many years, will usually die a very, very peaceful death on their own so that no one has to make a euthanasia decision or play God in any way. But they will go along pretty even keeled. And when it's time, oftentimes they will just take their last breath and that's it. So that's what I think we can all hope for, all of that. So I am going to be I did record this. I will be putting the recording up. And I hope that, acupuncture is becoming very, very popular in veterinary medicine. I talk to some students who I'm like, why? I always ask them, why are you here? Have you ever had acupuncture yourself? Some of them are doing it so they can have the complete spa experience and have their technicians go out and put needles in dogs in waiting rooms while they wait for the veterinarian. And I'm like, did you know that this is actually a very, very powerful treatment modality? And so we can't cheapen it. And it hurts my soul to feel like that's happening. But the other thing that can happen is when you do this to this ancient knowledge and these healing abilities, it will backfire on people. It will backfire karmically, and it will backfire on you and your patients. The same thing has happened in the sacred medicine world with ayahuasca. I mean, people go off and do ayahuasca, and then they're like, oh, all of a sudden I'm an ayahuasca master. And they start pouring medicine for people. And since some really not good things can happen, people can get stuck in different realms, different internal psychological realms that they can't get out of. But, the same thing can happen for animals. And we have to, there's a lot of different ways to stimulate acupuncture points as well. So if you are not a veterinarian and you don't have a license to insert a needle through the skin, I teach a course. I'm finishing up my second round. I'm not going to be teaching it this year, but I may start it up again later. But there are a lot of different ways you can stimulate acupuncture points. You can use your own finger and use your loving intention to do acupressure on the point. You can do moxa on the point. You can use essential oils on the point and meridians. You can use stones and lay stones on the point and even rub points with the stones. I just took a Taoist stone medicine course a week ago. You can use flower essences on the stones. You can use red light on the points, flower essences on the points. All these different things that you can do without having to insert a needle into the point. So I teach all of that to pet parents. Again, my second round of my course is finishing up this next year. I'm not going to be running it this year, but I will probably start it up next year. This year I'm focused on um writing 3 big lectures on the using 5 elements as a preventative wellness map, as a preventative wellness program for your patients, bringing us back to the connection between traditional Chinese medicine and nature all around us, this big fishbowl that we live in called planet Earth. And then hopefully having a book come out of those teachings and writings. And then I will start up my class again, maybe in 2027, possibly. So look for that. Follow me here. And I hope you guys all have a wonderful, beautiful weekend. And go get yourself an acupuncture treatment. It's a wonderful, wonderful preventative method. As we all start aging as well, it really, really does a lot to help the body. So take care, everybody.